A very good evening to all of you, our esteemed viewers. I welcome you to this show. This is Health Port. This is a program brought to you by Makerere School of Public Health in conjunction with Family TV. You shouldn't miss it. Of course, every Friday at exactly 7 p.m. we are right there in your living room. And thank you so much for watching Family TV. Yeah, Edrine Osteen Mukalazi is my name. And as usual, we have Fatna, Garenda, our sign language interpreter. And today we have our specialist or the panelist, and that is Mrs. Sylvia Kalegele. She's a senior midwife. And actually, Sylvia, I welcome you to this show. Thank you so much for coming, and kindly greet our esteemed viewers.
Thank you very much, Edrine. Our dear viewers, good evening, and I wish you nice viewing.
Well, thank you so much. You who has been following us from the time we started, remember this show is brought to you by Makerere School of Public Health, and it is handling what we call maternal health and early childhood development, as Professor Peter Weisot elaborated it. So, today with Sylvia, we are going to talk about labor. Yes, labor is actually labor is the most feared moment by all mothers. Everyone is afraid of going through that period. But maybe to someone who is hearing this word for the very first time, Sylvia, how can you explain it to them?
Okay, thank you, Edrine, so much for giving me this opportunity to explain to our viewers what labor means. But before I do that, I request that you allow me to remove my mask such that you can hear me clearly. Once again, I'm called Kalegele Sylvia. I'm a midwife, senior midwife, working in a government institution. And I've worked for quite a long time, over 20 years, in a labor ward or in a maternity, so to say. So what I'm going to share with is quite out of experience, out of what I've seen mothers go through, and even what midwives are supposed to do for the mothers who come.
In other words, you're speaking one as a mother and then as a midwife.
Yes.
So you have this full experience.
Yes.
So we get to labor.
Yeah.
How can you explain labor?
Labor is a natural physiological process which takes place in a woman who has been pregnant from the weeks of gestation, say 28 weeks, up to 40. That's when we expect that the pregnancy is ready for delivery. And it occurs for all women. Naturally it occurs, be it that you are at home or you are in the hospital. Once its time occurs, it's a natural phenomenon. And it involves that the baby, all the products of conception which God put inside the mother's womb will all be expelled.
Okay.
Of course, they include the baby, the membranes where the baby was living, the placenta which was feeding the baby, and even the cord which connects the placenta to the baby. They will all be expelled during that moment of labor.
Okay. In other words, this is a moment when we expect a mother to give birth to a baby.
Yes.
Okay. Sylvia, what are some of these signs of labor? When should a mother know that it is now time for labor?
Thank you so much, our dear viewers. We are going to quickly look at the signs of labor which you should expect as a pregnant woman. Number one, there will be contractions. The pains on the abdomen which you experience, they are called contractions. And what is contracting? It's the womb. And when this womb contracts, its aim is to make the womb open and expel all those products. So, number one sign are the contractions. They come in an interval. They are regular. They have a regular way of occurrence. Then they have a length that when that contraction starts, it takes probably 30 seconds or 40 seconds. And then they also have a frequency, how often they come. Is it every 3 minutes that is coming? Is it every 4 minutes that is coming?
There is this saying that the contractions of a male child are different from those of a girl. Is it right? Or they are all contractions, whether boy or girl?
Okay, for us as midwives, all skilled health personnel, we don't differentiate whether they are for a male or for a female. But the women themselves, they can share such experience, but it's not scientific. It's not scientific.
So besides the contractions?
Besides the contraction, a mother should do, when he experiences a discharge from her private parts, which is mucoid, like mucus. Sometimes it can be stained with some sting of blood. That is a mucoid discharge. We call it a show in midwifery. So when he experiences that, he should know that this is a sign of labor. Number 3, the back pain. They usually complain of back pain. Usually a mother would be there with her pregnancy, she does the housework and whatnot, but she will not be feeling the back pain. So when labor starts, there is that feeling of back pain, because the bones of the back are giving way for the baby to go through. So that giving way causes that mild back pain. Yeah, others do vomit. Yes, they can vomit, feel like vomiting, and they even vomit. Can be a sign. Then as the labor increases in intensity, the bag of waters, yes, we call it nsungwa in Uganda, it can rupture. But that one occurs towards the time for pushing out the baby.
Now, maybe before the bag, do these occur at once, these 3 signs you talked about, the back pain, the contractions, and then the whatever?
Yeah, they don't.
Do they occur at once, or they come at intervals, different intervals?
Thank you. These signs don't occur at the same time. So we are listing a number of them. Should you see one, and you have reached your time when you are expecting to deliver, because if you attended antenatal, they will tell you that we are expecting you to deliver maybe on the 9th of February, and today is 9th of February, and you see any of these signs I've been mentioning, you should recall what you were told in antenatal. So you can have at least 2 or 3 of what I've mentioned. Yes.
Okay, so are those the only signs we can talk about, or there are other minor signs that are not common to everyone?
There are some minor signs which can happen in other women, like excessive watery discharge. It may be watery, not mucoid, but it's not common in all women. What is common is that mucoid discharge. And when you arrive, we shall ask you, what sign did you experience? So you should at least be able to mention some of these.
Okay. So now our mother out there who is watching Family TV, yes, has seen 2 of these signs, or maybe 1 of these signs, or yes, all of these signs. What are the roles of this mother during this labor time? What are some of the roles? What is her major role in preparing for this period?
Yes. Very good question, Edrine. Dear viewers, like you expect the midwife to look after you when you come to the hospital to deliver your baby, we also expect that as you come, because you attended antenatal, there are certain things which they taught you that you need to have. So when you see these signs have come, you should think of hospital as number 1. And then, what do you go with to the hospital? That's your role. Because you
thinking of the hospital is, yes, number 1, not, yes, the traditional birth attendant.
Not the traditional birth attendant.
That is very important.
Yes, thinking of where to get skilled help, and that is the hospital. So we encourage all our mothers, first of all, when you, right from pregnancy, the moment you conceive, think of going to the hospital. for antenatal care. Then
Like we have always been
Yeah.
encouraging them in the
Yes.
previous sessions.
Thank you so much.
So, besides thinking of the hospital, what else should a mother equip
So,
herself with?
you have a bag. Right from antenatal, they teach you that prepare for birth. So, I have some of the things that I expect the mother to come with as part of her role during the preparation for childbirth. I hope all of you who are there can see. This is called a mama kit. This is a role of a mother or the couple who are expecting a baby to prepare. So when labor begins, it will be in the bag. Pregnant women usually, we encourage them to buy a bag. It may be a plastic bag, it may be a suitcase, according to how able you are. So what is in that bag is a mama kit. And the mama kit has items in it. The items which are in here, they help the mother. They also help the midwife to offer clean and safe delivery.
What are these elements?
Thank you. So I will open this mama kit.
Maybe as you open it, I've seen this particular one has Government of Uganda.
Yes.
So are they given out free of charge, or someone has to pay money to attain one?
Yes. Okay. Like I introduced myself, I said that I work in a government institution. And all my 20 years have been working in a government institution. And these items which are in a mama kit, we give them free of charge.
In a government institution?
In a government institution.
Okay.
So, when a mother comes, she will have her mama kit, which she prepared already. We have 1, 2, 3, 4, 5. This pack, it was new, you saw me opening it.
Yeah.
It has 5 pairs of surgical gloves. These are surgical gloves. It is inside a paper. Sometimes we get mothers, they come with these other gloves which people put on to prevent COVID and whatnot. Those are not the gloves which we use when we are going to conduct labor. So, 5 pairs at least of surgical glove. This is the cotton wool. This cotton wool.
Open it for the paper.
Okay. This is the cotton wool. It is in the pack. If you were unable to get the pack itself, you can buy items one by one until you make the band, isn't it? So this is cotton wool. It's clean. It's cotton wool.
Meanwhile, maybe as we look at, I can also open.
Hey, you want to
this.
open that one?
Yeah, so that our mothers out there can actually see the kind of gloves that they're
Okay.
supposed to
All
have.
right. So it has the 2 coverings. It has the outer cover and then the
inner
inside
cover.
to show to you that it's a surgical glove. Yes.
And its size is actually
It is
different from these common
7.5.
ones.
Yes, it is size such that it covers the midwife's hand up to beyond the wrist.
So I believe the mother out there has actually identified the difference between the
Yes.
two.
So we have these rolls of gauze. They are small rolls of gauze. They help after we have conducted delivery. We don't put a pad, you know the pad. We are going to make a pad out of this cotton wool and out of this. So we put the gauze over the cotton to make the pad. So basically, the components in the mama kit is to help the mother. Because it's not the midwife who will use the pad.
Okay, so now that our mothers have seen this gauze,
Yes.
Sylvia, I beg that we let this information run shortly and then we are coming back.
Okay.
We are coming back after that short commercial break.